रागादिरोगान् सततानुशक्तान् अशेषकाय अशेषान् औत्सुक्यमोहारतिदान् जगान यो पूर्ववैद्याय नमोऽस्तु तस्मै. Humble pranams and welcoming all the dignitaries, governing body members, members of RAV, all the gurus, shishyas, and Ayurvedic scholars who have joined today for the 172nd episode of Gyan Ganga webinar series. I, Dr. Pooja, on behalf of RAV, welcome you all for today's session, which will be conducted by Dr. C.M. Srikrishnan sir. On the onset, I would like to express my heartfelt gratitude to our mentors who have always been there to guide us, motivate us, and encourage us to sustain the series. Respected Padma Bhushan by the Sri Devendra Trigunaji, President Governing Body RAV, by the Sri Rajesh Kotecha sir, Secretary Ministry of Ayush, and respected Dr. Vandana Sirova, Director RAV. Now we'll begin the session with Dhanvantri Vandana. Om Namo Bhagavate Vasudevaya Dhanvantaraye Amrita Kalashahastaya Dharmamaya Vinashanaya Trailokyanataya Shri Mahavishnave Namaha. After seeking blessings, I would like to introduce today's expert, Dr. C.M. Srikrishnan sir, who is going to share his views on the topic traditional management of psoriasis in Ayurveda. It is a difficult task to brief his journey and achievements in Ayurveda. I take this effort to introduce him. He was born in 1958 and is one among the few practitioners in Kerala following the Ashtanga Vedas and the Kaikulankara Ramavarya tradition, that is the Kashyapa tradition in Kerala. He is traditionally specialized in Balachikitsa and Vishachikitsa and an expert in Ayurveda dermatology, especially Bala Visarva. He is currently running the traditional Ayurvedic center, Dhanvantri Ayurveda Bhavan at Nilvai, Thrissur, where not only clinical practice but also training, traditional training for different Vaidyas from different parts of the country keeps going on. He is also the director of the Dhanvantri Institute of Dermatology, where such trainings are organized. We are fortunate to have Sir as empaneled in the CRAV Gurus. He has completed his BMS with first rank in 1981 from the Ayurveda College, Kottakkal, and completed his MD in Kaya Chikitsa with a special subject Visha from Trivandrum in 1984. After that, he was appointed as a faculty in the VPSP Ayurveda College, Kottakkal. He was the professor and HOD in the year 2005. Later on, he completely devoted his time for his center. He has also conducted more than 100 episodes of Arogya Rangam and 365 episodes of a TV program dealing with Ayurveda drugs in the local channels CCTV. He has published various articles and journals. The noticed are a book, Avabhasini, a handbook on Ayurveda dermatology, and he has also translated English translation of Vishavaidya Jyotsnika, a Kerala traditional Vishavaidya textbook. He has also conducted various conferences and presented in several national and international seminars. There is a list of awards which Sir has been conferred with. A few of them I would like to mention here. P.S. Warrior Award from AVS Kottakkal in 1983. Vagbhata Puraskaram by Vagbhata Sarini. Then Gandhi Seva Puraskaram by Mahatma Gandhi Center for Education and Research in 2008. Vagdevata Puraskaram and Krishnatmi Puraskaram by various magazines. With these humble words, I would like to invite you, sir, for today's session.
All my pranams to all Gurujis and my Shishyas and the RAV family members and authorities. So directly I'm going to my slide and that will be very good. Okay, the slide is visible?
Yes, sir.
Okay. So I welcome. So today's subject, traditional management of psoriasis in Ayurveda. So what is tradition and other general? That's a question. We can say tradition is nothing but experience from the years to years and passing to the new generation. So what is the importance of tradition? Now I start with the history. This is a treatment of new generation. And the patient is an engineering architect student diagnosed by the modern allopathy hospital with a biopsy. That is, and is there a history, gutted psoriasis, and are here morphologic features favors gutted or eruptive psoriasis. Then immediately after the gutting, now Kerala there is a experience that in the if a patient is diagnosed psoriasis, there is a single drug called Ayyapala or Rhytia tinctoria, and the oil prepared. When he applied the Rhytia tinctoria or oil, then whole body become exfoliated and erythroderma happen. It is increased because this patient, even though the diagnosis is psoriasis, the patient previously suffering from atopic dermatitis or from child itself, he is allergic patient. And this is said, the patient is an architecture student. Daily he was taking 3 times chicken and night no sleep, all the abatya, ahara, vihara. And gradually he developed this. And when we checked his blood report, it was IG is 5,000 and ESR is 70. So actually this is an allergic dermatitis. And by seeing only the modern description, they diagnose, they're also diagnosed psoriasis and given the Ayyapala care. And this happened. So I think why Ayyapala is iti asya patram kadushnam cha kabhavada vinashram. Asya kadushnam. The patient is pitta prakriti also, the dosha is pitta. By applying the pitta vardhana oil, that disease is increased. So in the traditionally, we manage very easily with the 2 weeks. That I will come how we will manage. So what is psoriasis? Whether psoriasis is completely curable? That's the question asked by the common people and the patient. So Ayurveda, we can say the disease psoriasis is a lifestyle-induced skin problem. We can manage effectively and economically the patients suffering from psoriatic type disease with Ayurveda principles. This is the traditional word regarding the psoriasis. Because the diagnosed psoriasis, the management will be confused. That is the problem that example clearly described. Because when we are diagnosed with psoriasis, how we can give medicine from Ayurveda? So that we have to think. So what is the traditional approach? First, Roga Nidana, Roga Jnana. Roga Jnana is Charakat says it. Roga Jnana is very important. Here, apply the Pramanam. When the patient is coming, apply the Pramanam, Pratyaksha, Anumana, Upamana, Aptavati. What is Pratyaksha? We are analyze the patient Pratyaksha. Here you can see some Behirukshada, some Andasnigdada, Rajakiranam, or we can say white scales, reddish color, and the patient is Pitta Prakriti, and literally by either analyzing and this history taking, you can see that the Viridahara history may be there, and is not a problem.
These challenges, Basti service, and also Vamana or Virajana produce some poster.
I request all of you to mute yourselves, please.
Basti is so
Yes,
small,
lastly we can discuss. Let me finish my class.
there will be some
Yes, sir, it is not doubt. I think somebody's mic is on.
Starting up Pratyasha, then when the all the signs and symptoms, you can see that little Kabhavada Yoga. How? Again, Charaga. Suppose here you can see the Rauksham and Shavarunatam, Parushyam. It is Vada Lakshana. Pitta Lakshana only Kleda, slightly Kleda you can see here and there. And Kandu, Sthyrium, Ulseda, Gaurava Sneha. This is Kapha. So altogether there is Kapha and Vada's predominance of you can see. Then you think Anumanam. So what are the Kaphavada Roga? Charma Ega Kushtagidiba, Sigma Alasa Vibadiga, Vata Shetmol Bha, Shrefam Vita, Dirdu Shadashi. So here, among the Vata Kabaja, we are Anumana, this is Vata Kabaja and due to the Apati Ahara Vihara. Among the Sigma and the previous Upamana, previously under our Guru, we are sitting and we are seeing this type of disease. And we can diagnose it as Sitma Gusta, Sitmam Duksham based on the Krishna is a great. Srexasparsham, Tanu, Sheratamram, Daudika Pushpar, Rayana Chudhagayasya. So the diagnosis is Sitma Kushta. So since it is a Sitma Kushta and Vadagabada, again, Budebyo hi Paranjinda, Nasti Jinda, Chigilside, Charagasi. Again, go deep into the Baudiga Avsta. Here, Vadagabada, Bada, Vayu, Buddha, and Prithvi Buddha is deranged. Here, Agni is Vaishimya, the Rasadhadu, Dushti, Jala is very, very, very low. Here, Jala Buddha less, and Agni Buddha Vaishimyam, Vayu Prithvi is increased. When the Prithvi, Murta Prithvi, Vayu is, Rucha is attached, the crack is coming. So here, Vayu Prithvi Buddha is deranged. So what may be the treatment principle? So we have to increase Agni Jala Buddha in the body. So for increasing the Agni Jala Buddha, we can bring the best choice is Gridam. And as per the Pragati, we can medicate the Gridam. So here, if you are giving Mahatiktaka Gridam internally and externally, after a Koshta Virajana with Avipatti Churna. So that is the ideal traditional Bhaudika level treatment. Koshta Shodhana you do to because already there are Midyahara Vihara. So after Koshta Virajana, give Grida internally. Externally, you can apply Grida. But after that, since the Kabha water is for wash, reducing the Kabha, wash with salt water. Fish in the Lavanam server. While washing the salt water, the debris will go, the Kabha will pradisarna. After that, apply the Mahatikta Grida. Internally and externally, if you are using this style, Mahatikta Grida, as per the experience, you can get this result within 2 weeks of treatment. This is the traditional approach we are following here. So, but even though it is traditional, nowadays, the etiology or the lifestyle, everything is changed. So, nowadays you can see multifactorial etiological causes and multidimensional pathological manifestations in dermatology. So, we want multi-level applications of management methodology, targeting cleaning our disorders, stimulating our agnis, enhancing the organ functions, motivating the micro-level metabolism, aiming dosha samyam for tat prasadana. This is the basic principle because this is the parinamam of society. In 1980, when I passed BIMS, this was the teaching methodology. Now, when in your study, now we are talking in the 2024. What is the important? We are now talking in this. So we have to connect the past and present. Then only the students become confident. So let us see what are the new comments or new dimension of psoriasis, but the new science. Actually, it's a papillus disorder, well-defined erythematoplex with exfoliation, chronic and non-contagious. It is an autoimmune disease, and remission and relapse is more. Normally, as per the approximate statistics, 125 million people are affected globally. Now it is increased, I think, due to the different lifestyle. Incidence rate is 1.5 to 3%. No sex discrimination. Any age it can come. The first also maybe 15, 25 years, but different justice change. We can see 3 years old psoriatic patient or 40 above 60 age psoriatic patient. You can see. So what is the morphology? Actually, it is usually starts at extensor surface of extremities and buttocks. It is usually dry and small flattened bumps or red patches, red and large thick plaques, well-marked boundary, that is very important, and loose silvery scale you can see. What is the cause? But exact cause is not known. Maybe genetic, maybe autoimmune, maybe the environmental. The master switch is still a mystery. We cannot, at present in the modern world, they're not telling the exact cause. So maybe even genetic relatives of 1/3 cases have psoriasis. One of the parent 10% chance, both parent 30% chance. Many genes are associated. 9 locations on different chromosomes are identified. Major determining source 1. Source 1 located on the chromosome 6, which controls important immune function, but this is not 100% valuable. Maybe immuno-related, autoimmune, of course, this also cause we can say. Immune cells move from the dermis to the epidermis, T cells migrate, release cytokine. And the inflammation due to tumor necrosis factor, interleukins all will cause inflammation of the dermis. And interleukin 22 keratinocyte to proliferate. And dendritic cells induce the proliferation of T cells. That cause the exfoliation. But what are the triggering factors as per the statistic? Stress, climate. Usually in the winter season, it will be more. And medicine like lithium salt, beta blockers, chloroquine. Nowadays, the beta blockers people are using more for the BP, and that people are affected psoriasis more. And the cosmetics cause and the trauma, infection, more prone to dry skin people. And food, alcohol, exercise also triggering factors in most cases. So what is the pathophysiology in the modern? Excessive turnover of the keratinocyte. Dilation and cooling of superficial blood vessel, coiling of the dilation, coilation of the superficial is very important. That is it coming into play. Leukocyte infiltration into the skin. Mononuclear papillary dermis, neutrophils in the stratum corneum, intrafollicular epidermis not affect. All these Rhodo as per our science and Amashata. T lymphocytes migrate to the dermis, release cytokine, trigger the proliferation of keratinocyte, increase level of prostaglandin, increase growth factor, etc. And skin exfoliation within 2 or 3 days instead of 28 days. So this is the exfoliation in the psoriasis we are seeing. So what diagnosis as per the modern morphology? There will be some erythema, induration, itching, and scaling. And there will be some hospital pinpoint bleeding if you are removing the scale. And combination, that's wherever they are scratching, the lesion will continue to that area. And skin biopsy, normally parakeratosis, acanthosis, molymorphy in epidermis, dilate and toxicity of capillary. These skin biopsy we can see on several other conditions also. In allergic chronic dermatitis, we can see the same. So that will be mistaken. Here, histopathology. Normally, there will be hyperkeratosis and marked thickening of the stratum. That is the dry lesion here. And diminished granular layer, that is whitish color. And elongation of the dermal papillae. And dermal papillae. And here, the vessel will be more dilated and coiled. So if you are removing the stratum corneum, you can see the reddish colored part. But here in the dermis, there is patchy infiltration of dermis with the dilation of capillary. Even though here it is dry, inside it is ulclacia, it is soggy. So, and the classification, there may be, as per the morphology, gutted, plaque, pustula. As per the site, flexural psoriasis, palmar plantar psoriasis, scalp psoriasis, nail psoriasis. There is no effective treatment in allopathy. So these are the gutted psoriasis. And the small rounded erythematous lesion, 2 to 3 diameter, minimal scaling, hyperkeratosis will be less degree, followed by an acute febrile illness, confused with the drug rash. Actually, this, in as per the Ayurveda, this you can call it Sushridokta Kidbam. Sushridokta Kidbam, so little bit ulclacia will be there. Here, plaque psoriasis, hyperplasia of the epidermis, reflecting defective vasculature, and epidermal proliferation. This is pustular psoriasis, raised plaque with pustule, red and tender, localized or generalized with fever and systemic upset. Fever will be there. This is the complication like dehydration, electrolyte imbalance, hyperkalemia, hypoalbuminemia, and septicemia. Here, psoriasis vulgaris affect all over the body, severe scaling and erythema. This is flexural psoriasis in the flexus. Appears as smooth inflamed skin folds, armpit, thigh, genital region, under breast, etc. Aggravate by friction. Change of fungal infection. So here, some fungal infection also may be attached. This is a psoriasis of the penis. This is palmar plantar psoriasis, erythematic, thick, slippery scale, sharp margin, confused with eczema and fungal infection. This is nail psoriasis. And this is scalp psoriasis. Do not extend beyond, it is beyond the hair margin. Usually erythematous causes great discomfort due to the scaling to the patient, confused with dandruff and seborrheic dermatitis. And what are the differential diagnoses? It may, but we have to differentiate clearly with seborrheic dermatitis, lichen planus, drug reaction, parapsoriasis, eczema, and tinea. This is different level. This is tinea corporis. This is psoriasis. Here, how we different? Here, In the tinea corpora fungal, this Ayurvedic called it Dedro, Dirga Pradana Durvavat, Adasi Kusmacha. Here the whole lesion will be affected, and the periphery will be very, very active. Active periphery and inner center. Here the lesion will be less. Here the active. Here the whole lesion will be full exfoliation. So that we can differentiate. Here, tinea capitis and psoriasis. Tinea capitis will be some, it's a fungal infection. Some yellowish thick debris will be there. Here only exfoliation. This is eczema and this is eczema. I told you it is a continuation, a severe itching, and the color will be little bit black. Here, lichen planus sensori, lichen planus, red violaceous papillus. Ayurveda it is called kidiba. This you can call sigma. So, what is our concern? First, Yogaඥana, Nidanam, Purvarubam, Lakshanam, Upasham, Samprapti. By that, you have applied Darshana, Sparshana, Prashnam, and Dasha, Dosha Vaishamyam, Pragriti, and you give Shamana or Shodhana. And why Ayurveda, we can diagnose the disease very clearly and we can manage successfully. And the Nidana, first you Nidana. Charaga clearly written the Nidana and it is still relevant. I am not reading the some of the points. Shidoshna Langana Haran, Kramam Bukta the Shavanam, Karmashamai Vayartanam, Shironam. That is the Sita and Ushna is at that time different. In the summer, you are taking cold internally and externally. Even the AC. In the summer, we are sitting in the AC, and occasionally we are going outside. Again, we are entering the AC. That means the body is subject to different climate and different time. So the acclimatization process will altered. So some chemical will release in the body, or it will alter the temperature regular mechanism. And even if it affects the pituitary body, hypothalamus also, and along the stress. And here, Ajirna Madhyasana Jeva, Panchakarma Abhajarinam. This Panchakarma Abhajanam is very important. When the Panchakarma is in the wrong way, I'm remembering a patient, the type of Snehavana. The patient is an executive. Daily, he is engaging his work, and daily, along with the stress, they are doing Snehavana. And after Snehavana, Vamana, when everything is bad, immediately after the severe expression is coming. So here, Navana, Dedi, Malsya, Tila, Lavana, Amla, Nishavinam, Masha, Mulaga, Vishtana, Tila, Shira Gurashinam. All these are relevant nowadays due to the fast food, the untimely food, and the untimely sleep, ratri no sleep. All the lifestyle is very, very important nowadays to formation of this disease. So, Vagbala clearly described the pathology. Vidyahara Vihara Visheshanga. Sira Parvati Yakarto Klesika Asramisham Doshayanda Shadikritya Tischaranda Tadobihi, Tajik Kurvan divided into Kustamushan that Kale. Actually, this Kusta Nidana Chik Hamprapti is very clearly relevant in the Sigma Kusta or psoriasis. Here, think about what we the Samavasta of the skin. In the skin, you are taking in the subtle level. Here in the capillaries and venous and arterial end. Here the arterial end, venous end, and the lymphatic system and the cells. Here in the subtle level of the skin, in the dermis, there will be rasa, recta, mamsa, meda. Rasa is considered the plasma, including the interstitial fluid and lip. Recta is the capillary spool. Medomamsa, adipose and muscular tissues. And here Sweda is the sitting channel. Here Kava Pitta Vada. Kava is the protoplasm. Pitta is the metabolic function. Vada is the controlling function. Here the arterial supply sufficient and the nutrition to the interstitial fluid remaining the impurities will be passing to the venous end. The other remaining fluid will accumulate in the lymphatic system. So here, for the interchange of the nutrition to the cell, the interstitial fluid will be should be pure. In the pure interstitial fluid, the cell will be viable. Or when it is impaired, how? And why did arterial flowing of the blood should be in the correct way, and it to maintain the hydrostatic and osmotic pressure, and we can call it soda here when it is happened, or sodamsikalu parinamam abhadyana abhivagini bhavendayarathena. So When the blood is very pure, its specific gravity is normal, its content is normal, its flow speed is normal, then only this should be viable. So that is a homeostatic mechanism for samavastha in the skin. When this is altered, how it is altered? When the blood is impure, that means the specific gravity of the blood, the impurities in the blood, the content is different, everything will cause the arterial end is dilated. And recta dushti, that means it is coming from the amasya and from the stress. These are the two factors affecting and the disease and cause this artery impair, that is Srota dushti. Here, due to this, the hydrostatic pressure and osmotic pressure will be changed. Nutrition will be there. The viability of the cell will be loose, and it will cause cell death. Gradually, the upward movement of the skin is altered, and this becomes hard. By this, here the result of this pathological change, disturbance of the forces intraepidermal coherence or endodermoepidermal adherence. These are the two forces or what the function by which the skin layers are keeping acid and healthy and intact. When that is altered, the disturbance here, the exfoliation is coming, or the within 2 to 3 days, the cell will be exfoliating. This is the pathology. This is described by the Vagbada Toklesiga Asramishan Doshen Desredegirtya. Here, so contemporary concept we can say there is formation of an endotoxin in the blood, release of the free radical, increase in the body temperature, decrease in sweating due to the closing of the sweat gland. Hypothalamus disturbance will be there because there is the psychological stress and the effect of hormonal status, release of adrenaline, increase the body heat due to the apatyahara vikara, and effect on the hypothalamus. And here altered the forces, coagulation of the artery will be happen, increase proliferation of the cell and exfoliation starting. As for Ayurveda, apatya, ahara, vihara, and manasaya tension, rekta dushti, rektavaha srodo dushti, dhadu dushti, dosha dhadu mala sammurchanam, kosha nashanam, vikalan is happening. So what is our approach? Classical Kushta treatment. Here, Vata Kavahara, Dosha Shamana, incorporation of Dushi Visha also nowadays due to the Mistya Ahara Vikara and Viruddhahara. Viruddhama Vijahara Vidya Vishagarama, due to the fast food lifestyle changer and psychological aspect, Pathim Ahara Vikaram, Nidana Varibardhan, Samprapti Vikatam, and Dukpradikriya is the Chikitsa. Here, what is the principle? Here, this is a condition. So here we have to clear in the subtle level, not in the stula. Here, Srodha Vishodhanam to clear the channel. Medo Vilayanam, liquefy the stagnated fluid. Kaba Sravanam, remove the accumulated fluid. And Malashodhanam, eliminate of endotoxin. In Ayurveda, the Prasadana karma is doing by Shodhana therapy. So, Surya Shodhana therapy is very important. So, managing principles are the Prasadana, Srodha Shodhana, and Dosha Shamana by to relieve the symptom. First, we get to the symptom, otherwise the patient will go anywhere. We want to reduce the itching and exfoliation and reduce the inflammation, restore the circulation, clear the metabolic channel. Prognosis depends on the severity and chronicity. And here consider Jnana Vayu and Prajaka Pitta. Among these principles, you give the medicine, we can give Samana Chikitsa. The medicine will be Agni Jivana, Dosha Shamana, Srodha Vishodhana, Rakta Shodhana, Mutra, Mala Shodhana, and Yagri Sakshana. Or we can call metabolic improvement, liver protecting, diuretic, and percutive. These are the type of principal medicine we can give. And why I am telling the psoriasis? Because diagnosed psoriasis, confused treatment. These are the 4 diagnosed psoriasis patients came to my AP. Actually, this is here. See, the psoriasis here called Sitpa Gutta is shared and other. Here it is Vada Kabaja. Okay, this even though it is Vada Kabaja, as per the Kapha is more and the dryness is more thick size. Here you can we will diagnose it's a Charma Gutta. Charaga says, Dosha say, Yesya Vashya Kushteshu, Vishesha Lingam Udriktam, Seva Shamanan Muria, Tadap Paranchan Vandasya. Here also this is diagnosed. Here it is Vata Pitta. Here we can call it Visarpa. Here it is Pitta Kabaja. You can call it Ega Kushta, Ega Kimahash, Masweda, Mansashakar Sanim. Here it is Kabavaja Sigmum. So even though the diagnosed patient is psoriasis, Ayurveda dermatological diagnosis will be different. This is you can call it Charma Guttam, Asti Charma Garas Parsha Charma. Here Visarpam, Shekra Shikram Visarpandi. Here Ekagushta Megakyu Mahashu Atskazam Shagasan. Disease is consistent due to medicine great. So even though the 4 patient is diagnosed by the modern pathological device, Ayurveda in the traditional approach will be dosha, dosha meva tasya pradhanyam. Analyze the dosha avastha and give the treatment either shamana or shodhana. This is the traditional approach. That is, I told you, diagnosed psoriasis, confuse the treatment. If you are giving the, I told you, Ayapala or Rakchatindoria, if you can give Ayapala here, and if you are giving Ayapala in these 2 conditions, it should be increased because this Pitta is Animanda, Ayapala is contraindication Pitta Anivata condition. So this is the traditional approach, diagnose first. So this is the patient. I told you this is a Visarga. It is, don't, even though it is very which part of Pitta is there, patient is also little bit Pitta. Here, what is the Shamana prescription? Visarga, Vata Pitta. Here, 2 type of prescription you can give. Here, one is first. Here you can give Manjishtari Kasham and Tribala Guru. And since as per the food lifestyle, there will be some Gara concept. Villadi Chandraprabha you can for Swada Shodra and Navaisa Gulia to improve the recta and the throat. And here usually we are giving the Panchavalkari Kerda for Pitta Shaman also with your Kerda. Second protocol you can apply. You can give a Pitta is more, you can give a Virejana and you can give Pitta Krisa. And you can do the Pradisarvam with some Pitta Shamana Kashaya. Normally you can give the Guluchedi Kashaya and Pradisarvam and you can apply Mahatikta Kritam actionly. Here, if you are giving this Shamana, it will take a little bit time. The patient has not enough time. So I prescribe here Avipatti Virejana with 20 gram. Then I give Tikta Krita and Navaisa Gulia and wash with the Guluchedi Kashaya and apply Mahatikta Krita. You can get it, this result within 2 weeks. The first protocol will take maybe 1 month. So this is the traditional approach. Secondly, I told you this is Eka Gushta or Visarpa. You can also call it Visarpa. The patient is Pitta, it's really confusing, but don't think it is Pitta Kapha condition. Here, if you are giving Shamana, you can give Guluchya Dikashaya. And if for the Pitta Shamana, you can give Gantaka Rasayam and Dushi Vishadi Gulia. Shalanam with Vara, Tirbala Kashayam, Avagaham, and Shalanam. And here you can apply Mahatikta Grazam. You can get result like it is. Third, what is the important? This is a Shamana. You can give Shodhana. Acharya telling Pachat Chardhanam, Masan Masa Shodhanam, and but that depends upon the patient health, patient's condition. But anyway, Shodhana is very much Shodhana as well. Vamana Virejana Vasti Nasya, Rektamoksha. And here Vasti Nasya is not prevalent because this condition. Here Vasti you can give when the Sitpa Kushta, when joint lesion is such as you can do. And Rektamoksha is very important. Vamana Virejana also very important. And his Nekabana and Svedana is very important. And after in the chronic case, after the Shodhana therapy, as per the Kerala tradition, you can Kai Seka, Takradara, Lebana, special Lebana, we can give, you will get a good result. So, what is the effect of Shodhana? Actually, Shodhana, this is it coming under Kushta? It's a Saptadadu Dushti is there, and it is a very chronic, so full treatment, full Shodhana will be there. Here, you can give biopurification therapy. There are 2 types of transmembranous purification and transcutaneous purification. And Snekabana and Swayasana stimulate these biopurification therapy. So first you give Snekabana and Swayasana for biopurification therapy. That is purified by transmembrane purification and transcutaneous purification. Then there is a trans-eternal purification therapy by Panchakarma, Vamana and Virejana. Depends upon the patient's condition, patient's capacity, patient's health, like that. And the other systemic purification by Rektamoksha. So these are the 3 types of purification by which we can manage the so-called psoriasis very effectively. Here, what is the importance of why this purification or Shodhana? There may be endotoxins for Mala Sanjaya. Actually, what is the endotoxin? We have to more clarify. The excretory and waste products are thrown out by plasma membrane through exocytosis from the cell. Actually, that happens in the cell. The disease is in the subtle level, it is coming in the cell. And after the cell, it's a group, then all the organ. So waste contains more nitrogen molecules and carbon dioxide. When the waste remain in the cell, due to failure of exocytosis leads to pathological condition. This is happening in the cellular level or subtle level or sukshmavastha. In the sukshma sharira, maladushti is happening. And the biomembrane, that's cell membrane, shows selective permeability and retentivity. Lipid soluble substance can have better permeability. Biomembranes are like endothelial reticulum, endometric reticulum, helping detoxification of toxic chemicals by conjugate lipids and protein. And in cell complexion of molecule to form lipoprotein. Actually, the lipoprotein is very important. So there will be a word called a complexion of molecule. In the biotechnology, if you are referring biotechnology, there's a word complexion of biomolecules. So in the cell, this is happening. Complexion of molecules happening to form lipoprotein, glycoprotein, phospholipids, sulfolipids, etc. It is very important. So here lipid is very important. Lipids, actually we are giving snehana act as lipidizing function. That is the snehamana is very, very important for not patients. Most of the people are not doing snehamana regularly. We are doing other sadhana therapy. Even some relief will happen. But full, if you want full relief, Samyak Ritya Snehamana is very good to clear this the cellular dysfunction. So when Snehana is introduced, it may improve the complexing of the weights and make it easy for the exocytosis since the cell membranes have made up of lipoprotein. And it facilitates the diffusion through biological membrane. Can cross the barriers which is a thickened cytoplasm. So when the cytoplasm thicken in the cellular dysfunction, the lipidizing function is allow the exocytosis more. So the waste metal can go to the circulation. So what is the importance of Snehamana? And the Shodhana Snehamana and after Snehamana, Shodhana acts through the systemic channel. Purva Dharma, like Snehamana, acts through the biomembrane. It stimulates the diffusion process. It fulfilled the effect of Shodhana process. It has both the curative and preventive effect. Even the Snehamana itself gives good result. So Snehana is very, very important. This is one of the example of Snehana. This patient is psoriatic bulgari. After the Snehana and Sedana and Viredana, this result happened. So that is the effect of Shodhana therapy. And this is a postular psoriasis of the treatment. After the Luchana Kriya, we did Tikta Kashaya, Tikta Snehamana, and this Swedra, and this the result. And this is Pamar Plantar, sorry, we will call it Vipadia. These are the systemic treatment Takradara we take. So this is the result. And this is the simple treatment of internally Snehana and the simple Viredana. It's a 14 years old child. And this is actually, this is diagnosed psoriasis, but analyzing the patient have allergic eczema. IG is 5,000 and ESR is 70, and different food cause different allergy. He's working in the Gulf. He's always sitting in the area AC and occasionally going outside. It was 4 years chronic. And after the Panchakarma therapy, Snehapana, etc., so he got this field. The patient he come Hyderabad. This is actually also diagnosed, but this is a lichen planus patient. As per our side, we can call it Kidibagutta. Utram Kanagaras person can do Parishasidam. And this also Panchakarma therapy, we can get the result. So there very important is Pathya Bhatya. It's the most important. The patient should use non-spicy vegetarian diet. Maybe they have to follow years and proper nutrition with enough fruits and vegetables. In the exfoliation is there, drink a lot of water and fluid, proper sleep and healthy family communication. Avoid non-veg, fast food, bakeries, smoking, tobacco, alcohol, and these are the Pathya Bhatya Ajare telling. You can select. And not the here, one important, the treatment. Hello, who is speaking? Here, especially as the skin regarding in the embryologically, the skin is developing. The epidermis is developing from the ectoderm, from where the central nervous system is happening. And the dermis is developing from the mesoderm, from where the intestine is developing. So both the nervous system and the intestine is the causative factor. Among that, we have to manage the brain and the stomach. So sorry, psychological treatment, physical treatment, shodhana and shamana. These are the treatment concepts. And psychological aspect, rearrange and educate the counseling. You have to teach the patient, and medication if necessary only. Yoga and meditation is very good result for you, Abhinav. And along with the Eve Bhasha and Saptavjam is also important. We are ordering Namopadi, Brother Damanda Eva Sema, Tyaga Shila Biyogi, Dijaguru Puja, Sarvasatresh Maitre, Jena Jena Visaswara, Bhaskar Aradhanane, and Bhaskar Aran the early sunrise, Bhakaravadi is Bhaskara. Early sunrise light is very important. And that along with Surya Namaskara in the early morning is very good for this. And also do some Devya Vibhasha Chitsa in the chronic case. So, and this is actually we adopted as per our tradition, we are adapting, and we have a project, C project, scientific, economic, effective, and management. Our holistic C project. Actually, it is a patient. He is a captain of a ship, full of tension and lot of fish, and he came here. And in this patient, as per our special project, we will give only Kaishara Gulgul to Dosha Shamana, and Vilyani Gudia for Gara Shamana, Chandraprabha for Soda Shamana, wash with salt water for Kavaharna, and apply coconut oil or water. Pathyam, and morning only some porridge with rice or wheat. Only lunch, rice and vegetable. Night only fruit. 30 glasses of water daily. These are another 20 minutes sunbath early morning, and some relaxing things like some Sarasama, Vishnu Sahasrama, Japa, or any other as per their condition. So this we are giving to the patient after that. Actually, this patient is very cooperative. He is tried several treatment, and this if you are applying, you will get result like this, combining physical and psychological treatment. This is our project. And another thing, and there is an economic treatment. Here by giving this medicine, you can need only 100 rupees per week. And the result of evidence-based clinical trial, scientific, economic, effective, and don't give more medicine. If necessary, or less medicine as per the dosha, you can manage with this economic treatment. So here I can share you our actually for the last 5 years of statistics, nearly 500 patients for the last 5 years we have managed totally 100 patients per year approximately we are getting. Among these, 30% full recovery only Shamana with Pathya. If you are in Shodhana Chilsa, 50% will be full, and Shodhana with Pathya 70% is only lifestyle channel we give 20%. So this is our statistics or traditional. Maybe I'm not telling the theoretical. I'm only clinician. I'm managing. The more theory you can, a good academician will use the clarification of what is the scientific approach of all this. This is our traditional Ayurvedic clinical approach. So let me conclude. You forget the word psoriasis. Of course, psoriasis patient is coming to you. It is a lifestyle problem. So we can manage effectively and economically the patient suffering from psoriatic type of disease with Ayurvedic principle. We should consider psychological, pathological, physiological, sociological, and economical as per the patient. The yukti of Vaidyan play a major role. So be a Vaidyan knowledgeable person. For psoriasis, advise the patient hold some food, wear natural air, cleanness of the skin, sufficient sleep, necessary exercise, proper sex, calm and peaceful mind, avoid curry, worry, and hurry. So these are from me. And if you want any doubt, you can contact in this number. Within my limitation, within my capacity, I will answer. Okay, thank you very much. Thank you for the RI for giving a chance to share some experience to the eminent knowledgeable Gurujis are there, and Shishya is there, knowledgeable persons is there. Anyhow, thank you very much. All the best. Ram to all. Namaste.
Thank you so much, sir, for a wonderful session. I think all the scholars who have joined here would have gained some confidence and knowledge regarding this topic. The session is open for discussion. If any doubts or queries, it can be shared or asked now.
सर इसमें स्नेहपान के लिए घृत कौन सी लेना चाहिए?
Pardon?
Sir, Grita
Hello.
for Snehapana.
Grita, Snehamana for Grita.
कौन सा?
Grita, medicated Grita for Snehamana.
और स्वेदन के लिए तेल?
Please translate.
Sir, for Svedana. Sir, medicated Grita you told for Snehana. For Svedana, what to use?
For Svedana, we will apply coconut oil, medicated coconut oil. As per the condition, we will have Eladi, Panchvalkadi, like that. If the pitta is attached, Panchvalkadi, you can, or the water gabaja, normally water gabaja, you can use Eladi. Eladio, water gabaja, Visham Sevenetri, Varna Prasana, Kandu, Pedaga, Kotamachana.
Thank you, sir.
Krishanji, very thanks. Delivered your lectures. Very thanks.
Pranam, आपका आशीर्वाद चाहिए. Pranam.
Fulfillment of knowledge, good treatment, good diagnosis of psoriasis. Very impressed our Shishyas. Very thanks and grateful to you.
Any other doubts or queries?
Could the type record record
Record
give to other the student should teach now. It should give to the
Sir,
students.
the use of Aragvat will be in which dosh pradhan kusht, sir?
Can you please repeat?
The use of Aragvad will be in which dosh pradhan kusht, sir?
Sir, Aragvada, in which?
Aragvada normally we will use the Kava Pradhana.
Yes, sir.
Aragvada is Chatti Kushta Vishan Jalamisham Kandu Prana Hecha Medo Dosha Nirvana. Kabhadushti and Medo Dushti. In that condition, you can use Aragvada. For Shamana outside Aragvada Kashaya, we can use in the more Kaba condition. When the patient is with Kaba Pragati, along with the Vata Kaba, the Kaba will be more. In that, we will give as a Shamana Aragvada Kashaya, we are giving.
Okay. Thank you, sir.
आप रस चिकित्सा में सर कुपी पर रसायन का प्रयोग करते हैं कि नहीं करते? ताल सिंदूर है, शिरा सिंदूर है, इसका क्या भूमिका रहती है चिकित्सा में आपके विचार से?
Sir, do you use Rasa Ushadis?
Yes, in rare case, I will give this Ganga Rasana, we will give in the Pitta condition. Actually, no, in the Ganga Rasana, I am not, Surya Prakash Sharma, forgive me if you are telling any mistake. He is the man Rasa Ushada, Surya Prakash Sharma. So, in Pitta condition, actually, there will be exfoliation either. Actually, the Ganga will, the constriction of the skin. The endosulfan toxicity, the skin becomes ichthyosis. Soria is the opposite function of ichthyosis, and the ichthyosis caused by the Gandaka. And this psoriasis is exfoliation. In that, Gandaka is very effective. So in that case, in the patient, as per the country, rare case, I am using Gandaka Rasana. And in the rare case, in the inflammatory case, that the pustular psoriasis, I will use this Arogyavardhani also I will use. And this Loha Sinduram, Navaisam for Tekta Shodha, I will use. No other, the Sauda not using. No. Yeah, I'm using mostly Kashta Ushadas.
But very good role of Panchitiki Ghatam. Very Panchitiki Ghatam is very nice and good role in the psoriasis. And Tal Shindur, Shila Shindur is Rasmanikya. You just.
Yes. And because normally we are using, that is a problem. We are not experiencing the Saushada here. It is not available. We are coming this as out of your place. And here it is too costly also.
Excuse me, sir.
Yes.
Sir, which kind of drugs is used in Nasya in different doshas in Kushta?
But I'm not here clearly.
Sir, drugs used in different kinds of Kushta based on dosha, like Aragvada for Kafaja Kushta, for other doshas.
In Nasya?
In Nasya. Actually, yes, in Kushta, Nasya is rarely practiced. So normally when Nasya, after the Shodhana therapy, when the patient become more Vadia, You can normally we are giving Ksheeravala Asya. No other drug we are normally using.
After Shodhana.
After full Shodhana, we are giving Ksheeravala Asya. In
ठीक है
Ksheeravala
सर.
it contain Bala and milk. Milk is Kapashamana and is water.
ठीक है सर. Thank you sir.
Okay.
Any
Excuse me,
other
sir.
queries?
Yes, please, may I speak? Hello.
Yes, sir.
Sir, actually, you told about external application in different recipes. The coconut oil, the narikela tailam. But classically, hardly we see the usage of narikela tailam or coconut oil in Siddhma Kushta or this any course. In classical text, usually we don't find coconut oil. We use it because it is popular. You use in Kerala and which is readily available or anything. But classically, in classical textbooks, coconut oil is hardly explained.
Yeah, I mean, classical tradition of the Kushta external application is more described as this Krita application and Lebana. And
Yeah.
and the rare case you can apply Thailam and Yamakam like that. But Thailam is Tok Tosha Krit Adatushyam. So in Kerala climate, as per the Kerala climate, the coconut oil is very more effective. That is, we are using coconut oil. Eladi Gardailam, Manjavalkadi Gardailam, Barandiadi Gardailam, all are preferred by the Gardailam, coconut oil. And coconut oil is more effective in the skin disease also. And
Okay, thank you,
secondly,
sir.
since our
Okay,
Kerala,
thank you, sir. No, I do understand. I do understand
one more thing I
about
can tell you. In Kerala, the climate is very, very moderate. There is no too cold, and in the moderate climate, the tradition is a custom. Even the child, they are applying coconut oil daily. So it is me also, coconut oil.
So, sir, one more thing I wanted to know, as you said in the beginning, the Raitia tinctoria, the modern people, and based on the research also, Raitia tinctoria, that Shwetakudaja, some pharmacies are preparing this recipe, and it is effective as well. But only the thing, apart from that, according to classics, the Mulaka Bija several times praised in Siddhma Mulaka Bija.
Mulaka bija,
Mulaka Bija is the number of times as external application. Kushtam Mulaka Bijam Priyangavaha Sarshapasthatha Rajani Yetat Kesar Shashtam Nihanti Charakarajam Kushtam. So this is and one more recipe. Shikhari Rasena Pishtam Mulaka Bijam Pralepataha. So Mulaka Bijam is repeatedly explained in the treatment of Siddhma Chikitsa. But in your the experience, in your presentation, see Mulaka Bija is not mentioned any time.
Actually, here we are not using that Mulaka Bijam. Here mostly we are using other Nimba, Punarnava, Nimbam, and Khadija. All these are using for Lebanon. In Ashtanga, there are several Lebanese described. Cotton Damala Vatraman Shirasagasi. Like that Lebanon we are using more. Availability. That also, as per my experience, I am not using Mulaka Bija. Because other medicine is also getting good result.
Okay, thank you, sir. Thank you.
Okay.
Any other queries? Sir, there is one question. In cold climate, which oil will be good for local application?
In the cold season?
In cold season, which oil should be preferred for local application?
For skin disease or other normal? If there is no skin problem, you can apply sesame oil, Saridhanandar Thailam, or Balashagandari Thailam. Or if any problem with skin, you can apply Eladi Thailam. Skin disease, you can apply even the child or even the child, you can use this techipu, ixara oil, or even the teenage, you can use eladi kardailam. And the older people, you can use parandiyadi kardailam.
Thank you, sir. Any other queries?
We can use tuvarak tel as a snehapan abhiyan, sir.
What? I'm not clear.
Can you please repeat?
Tuvarak tel
Tuvarak tail.
as a snehapan.
In this case, it is better to avoid it. Tuvaraka is a tikshna. In the chronic lichenified charmakutta like cases, you can apply Tuvaraka. Normally, it will not use in the sex but as per the patient's health, only it is advisable. Yes, karanja oil also you can use, but see, there is no oil. No, depends upon the condition, depends upon the dosha. Analyze the patient and give as per the medicine. Pityriasis vesicola is not a sigma. Pityriasis vesicola actually it is a vindu kushta. It is fungal infection. In that nimbadi churna with buttermilk you can apply. That will be very good. In Sitpa, several leva is liquid I can use.
No other queries?
Okay.
No doubts? No your experience? Anything you would like to share or discuss here?
If any doubt, send in this number. I give a number. You can go for it. WhatsApp number. I will.
Yes.
Okay.
Sir is always open to any doubts and he is always ready to teach us at any point of time we approach him.
Okay, from Achil Kumar Tripadi and Sri Krishna Deval, all. Namaste. Nannai good day. Thank you, Pooja. Well, coordinated.
So with this, I would like to officially conclude the session. I would like to, on behalf of the organizing committee of RAV, I'm sorry, there is a question. Can we do Snehapana in weeping eczema?
Pardon?
Can we do Snehapana in weeping eczema?
Yes, in the weeping eczema, first give some ama shamana and reduce the kapha and reduce the ultration. After decreasing the ultration, when it is vata kapaja, you can use Snehapana. First give Rushna Kriya. Even normal patient, before Snehapana, you have to give Rukshana. Here we will give some Haridrat Akram before starting the Snehapana. Or 2 weeks Kashaya.
How many days for Amapachan?
Maybe 3 or 5 days. For Rushna, only 1 day is enough. Takram.
Acanthosis nigricans. Can you please clarify the question?
And then
Somebody has posted, Mr. Dikshit Raj, Acanthosis nigricans. What do you want to know about the disease or the treatment protocol? Please clarify.
Acanthosis nigricans. Acanthosis nigricans. And question
about the treatment protocol of this
unknown user. About that, sir, please tell me any leva oil for Kandu in skin disease. Any leva in the Kandu, you can use Eladi Churnam or Nimbadi Churnam. And the vehicle is very important. If the patient is Nikda, you can apply with buttermilk. Or in the normal, you can apply with water. Or it is too dry, you can apply with coconut oil.
Any more queries? So, with the permission of all the dignitaries present today in today's meeting, I humbly offer my pranams to Sri Krishnan sir, all the gurus present today, all of you who have. I am really sorry, there are a few more questions. And we are glad to have discussions. So, what are the factors to be considered and re-verified when Shamana does not give relief? At this time, can we do Rakta Mokshana?
I'm not getting the question.
Sir, Rakta Mokshanam, when,
Ah.
what is the time for Rakta Mokshana?
Yes, yes. Actually, Rakta Mokshana, after the Panchakarma therapy, after the purification, only you have to Rakta Mokshana. Rakta Mokshana you can do in the severe cases, even the very section, 200 or 250 ml you can take over. After the Snehamana and after the Shodhana only. And the local area, you can do in the local round area, you can do leech therapy also, you can do. Leech therapy is also, because that will cause the coagulation of the capillaries in a little bit direct. So there will be not be recurrent again.
What can we do for tanning or discoloration of the skin?
Tanning discoloration. That depends upon the patient. How much tanning, what the causes.
We are about to end today's session. Any further queries can be posted to RAV or to Sir personally.
Yes.
We would be more
Yes.
glad to keep this discussion on and continue our journey in learning Ayurveda. I would like to extend my sincere gratitude to all our mentors, all the gurus who have joined us today. Most importantly, I would like to convey my thanks to all of you who have joined today and making this webinar series a successful one by your active participation. Last but not the least, I would like to thank each and every member of RAV and the organizing team who worked behind stage also to make this event successful. Our next session will be on the 6th of June by Ved Upendra Dikshit, and he will be throwing light on cancer in Ayurveda perspective. So till then, let us continue to learn Ayurveda, stay happy and blessed, and continue to practice Ayurveda. Shubhadinam, namaskar.
Come to all.
Namaste, sir.